Good afternoon. On behalf of my colleagues, I'm pleased to present to you today our data of S1929 phase 2 randomized study of maintenance atezolizumab versus atezolizumab plus talazoparib in patients with SWOG1929 positive extensive stage small cell lung cancer. It's a SWOG study. Our design for the study has been that we randomize patients with SWOG1929 positive small cell lung cancer into receiving either maintenance atezolizumab in arm A versus atezolizumab plus talazoparib in arm B following induction therapy with platinum, etoposide, and atezolizumab. Our hypothesis is that the addition of talazoparib to maintenance atezolizumab will improve progression-free survival in SWOG1929 positive small cell lung cancer. Our primary endpoint is primary progression-free survival. Our secondary endpoints have been overall survival, overall response rate, and assessment of toxicities. Our translational medicine objective is to bank specimens for future correlative studies. Our S1929 study comes not only with a novel agent, talazoparib, but it comes with a novel agent that is accompanied with a predictive biomarker that's SWOG1911. SWOG1911 prevalence have been noted to be 50% of patients of small cell lung cancer. We predicted that 85% of those patients will have evaluable tissue and 68% of patients with positive SWOG1911 will continue to have the maintenance therapy within the study. Assuming median progression-free survival of 4 months in the control arm, a design of 90% power to detect hazard ratio of 0.56 using a one-sided 0.1 level log rank test would require 78 progression-free survival events. We expected to screen 323 patients in order to achieve 84 eligible randomized patients. The stratification factors have been performance status and prior thoracic radiation therapy. Our primary objective of the study is met, where patients who received atezolizumab and talazoparib achieved 4.2 months in progression-free survival compared to 2.8 months in the maintenance atezolizumab alone control arm. The follow-up time is 5 months. Grade 3 or higher treatment-related non-hematologic adverse events occurred in 13% in the atezolizumab arm compared to 15% in the experimental arm of atezolizumab and talazoparib. Hematologic toxicity, however, happened in 4% in the control arm and 50% in the experimental arm expected for the talazoparib. Only 3 patients discontinued treatment due to toxicity, 2 in the atezolizumab alone arm and 1 in the experimental arm. So in spite of toxicities, there was not a lot of disease treatment discontinuation. As a conclusion, S1929 met its primary endpoint, demonstrating that maintenance atezolizumab and talazoparib improved progression-free survival in patients with SWOG1911 positive small cell lung cancer. Hematologic toxicity was increased with the addition of talazoparib and atezolizumab as expected, mainly grade 3 anemia. This study demonstrates the feasibility of conducting biomarker-selected trials in small cell lung cancer, paving the way for future evaluation of novel therapies in selected small cell lung cancer populations. We are currently analyzing the association of SWOG1911 expression levels to the clinical outcome.